Happy Wednesday, guys. We are happy to be live with you. We've got a very special topic today. I'm Jen Lormond, exercise physiologist, co-creator of Tighten Your Tinkler.
And I'm Christina Walsh, physical therapist, co-creator of Tighten Your Tinkler. We're so excited to demystify some what can be very confusing terminology for you today. Jen understands firsthand what it can be like to hear this stuff applied to you and go, this doesn't help me at all.
This makes no sense.
So what was that like for you?
Well, so we know if something's not right down there, right? We're having a deeper conversation today about pelvic organ prolapse and really what that is and demystifying it, as we said in the intro here. But we know when stuff doesn't feel right down there. So maybe it's heaviness, maybe it's pressure. And so you go to the doctor, you finally find the right doctor to even be able to diagnose this.
Which is a step in and of itself, but it's usually your gynecologist.
And, your OB might have said, you just have, what I was told was you just have some vaginal hernias. Okay, so I've got that kind of simmering in my brain. And then you go to a urogynecologist and you find out you have a urethrocoele, you've got an enterocoele, you've got a cystocoele, you've got a rectocoele, and you've got pelvic organ prolapse. So in my mind, I'm like, oh my goodness, I have like all of these things going on and no clue as to how any of that related to any of the symptoms that I was having. Pain with intimacy, not being able to completely empty my bladder, back pain, peeing 25 times a day, having incontinence issues, you name it, pressure. So we're trying to help demystify that. If that is you, we gotcha.
Yep, and if you're overwhelmed and you've been told one or all of those words applies to you and nobody helped you connect the dots between what does that mean is going on in my actual body and why does that have anything to do with the way I'm feeling, we're going to draw those lines for you today and hopefully a way that makes it more simple and more clear. That's our goal.
Yes. So we've got some great imagery that we think is really valuable and helps kind of eliminate some of the confusion. Pelvic organ prolapse is really just a more general diagnosis of all of these different specific things that we're going to talk about. So that's why everyone's prolapse is a little bit different because each case is individual.
Pelvic organ prolapse just means that one or more of the organs that sit in this pelvic bowl between your front of your lower abdomen and your tailbone basically is succumbed to gravity and is falling down and out of place. And we're going to revisit some imagery that's going to help understand what that looks like inside your body and what that means. And then further dissect cystocoele, rectocoele, enterocoele. It's all types of pelvic organ prolapse. So should we bring in the images?
Yes, we should. Let's get to the good stuff.
So Jen has been, what I would say is very brave to be willing to show us her personal picture of her unique situation of pelvic organ prolapse.
Good job.
So this up here is what the normal anatomy should look like. And this is, imagine you're looking at a body from the side and you cut it in half down the middle. So you can see here that ideally in a pre-pregnancy, pre-aging process situation, you have a nice stacked situation where bladder we've highlighted in red and then uterus is yellow and vagina is right underneath that vaginal compartment, vaginal passage is all highlighted in yellow. It should be stacked kind of nicely on top and behind bladder. And the rectum and the rectal passage should be right behind that. And we've highlighted that in green. So this is the normal anatomy. We're going to pull back and you can still see that normal anatomy as it stands in contrast to Jen's unique situation of pelvic organ prolapse. And here's where we can get into, okay, my doctor told me I have a cystocoele, I have a rectocoele, I have vaginal vault prolapse. I have uterine prolapse. What in the world does all that mean? So we've kept the highlighted colors the same so that you can re-reference this normal anatomy picture right up here as we're going through the, diagnostic situations and terminology that have occurred. So for Jen, she has the cystocoele is the bladder prolapse. And that here again in red is where the bladder, again, pelvic organ prolapse is just the falling down and out in a more extreme circumstance of an organ in this pelvic cavity. So this is her bladder, and you can see it's kind of diving, falling, whatever you want to call it, down and out, compared to where ideally it would be kind of sitting up nice and high here above the pubic bone. Hers is falling down.
And the urethrocoel, you can see, is that knot, I call it the kink in the hose.
Yeah, that is exactly how Jen has always described that to me. When she has described the feeling of not being able to completely empty her bladder.
Yeah.
She describes it as the kink in the hose, and that's because the little passage tube from the bladder to the outside of your body right here, as you can see for Jen's, is kind of smushed up instead of nice and lengthened here in this image. And that's why she often feels, especially if she doesn't do that bladder technique to lift and reposition that bladder, that she doesn't fully empty her bladder when she's using the restroom. So the next piece is the uterine prolapse. So here again, to contrast, this is the ideal position, and this is the position Jen's uterus is sitting in, where it's kind of sinking and falling down into the vaginal passage. This is hopefully allowing you to see why pressure, why downward pressure is a part of these symptoms, as well as any variable level of control issues, say for emptying your bladder, and why painful intercourse is an issue.
And tampons.
And tampons, a huge issue. The next one we're going to talk about is the rectocoel. So we have the quote-unquote normal positioning here in green of the rectum. Here over for Jen, she has a slight rectocoel. So that's where this part of the rectum is just protruding forward, down and forward for Jen's rectocoel situation.
Into the
vaginal compartment.
Yeah, because I think it gets confusing for some folks to understand. If they look down there, you might not see something coming out, but it's actually the bulging of the two into that vaginal compartment, which was confusing for me. Yes.
Absolutely. So we hope that discussing some of this stuff helps clarify. And the vaginal vault prolapse is another one.
Entero.
Yes. So the vaginal vault prolapse would be after you've had a hysterectomy. If you've had a hysterectomy, this uterus is no longer there. So imagine you've just taken out the uterus, but you can still see that even without that uterus, there's collapse of the vaginal passage tissue right through here, and down.
Yeah, the other stuff fills the void of where the uterus was.
Absolutely. So there's your vaginal vault prolapse. And again, not to be overwhelmed, all of these different kind of specialized terms are just types of prolapse. The last one that is maybe the least common to talk about is the enterocoel. And that is basically just the small intestine, which sits above all this stuff in your abdominal cavity, pressing down into this area. We've drawn a little orange arrow right here. It might be a little bit hard to see, but the enterocoel is the small intestine pressing down into this area. So just more downward pressure, more soft tissue that is meant to help support these compartments between each other and to hold the integrity of the positioning has failed and collapsed and is no longer what it used to be. But the good news, back to the good news. There's hope. There is hope, guys. Even if you're dealing with these diagnoses, Jen's situation is a stage 2 of both, I believe, uterus and bladder. Is that correct? Mm-hmm. So even with a stage 2 uterine and bladder prolapse, or cystocoel, you could say, and a mild rectocoel, Jen's got pretty great control of her symptoms and can still live a full life and do the things she wants to do with her family and her friends and her partner, her husband. So with less symptoms, and that's where it's at. You know, we have this conversation all the time about what does feeling better look like? Yeah. What does that mean? And it means being able to do the things that you love without discomfort and having tools in your back pocket for when urgency, frequency, back pain, hip tightness, pressure, when those things kind of rear their ugly head, you've got some tools in your tool belt that you can deploy where those symptoms might last for 2 days versus months and months and months and months and months. And with the strength you gain in our program, you're going to have less of them to begin with. Yeah. And the things that used to provoke them will no longer provoke them at the same threshold. So that's what we can promise, that you will gain through the Tighten Your Tinkler Women's Pelvic Recovery Program. It's been research validated. We have 40 women go through this program, and we got the data, and it was better than we expected. And that is why we're here with you today, because we want you to know that there's hope and that we're here to offer you that option to join the program and get the same awesome results that both Jen and I are able to live and experience, as well as all the women that we work with here in person. So we want to get this out there for you too.
And we know it's overwhelming. I mean, I can speak to the frustration of, I think I'm pretty educated, and this whole process was overwhelming because I was trying to put together nuggets of vaginal hernias and then this terminology and then it's this, and trying to then figure out what symptom, making that realization that all of these different things that I was feeling were all related to this condition, to pelvic organ prolapse. So sometimes, you know, when you go to tightenyourtinkler.com, you can see on there all of the different symptoms that we're talking about, because it is a very large list. But the great news is when you start increasing that muscle tonicity, that up and in.
You can see probably very clearly from this picture, the down and out force and falling is really the problem causing all these symptoms, and this program gives you that up and in again. That's what anybody who's suffering with this stuff needs back in their body, and our program will help turn on those muscles that will work for you throughout your daily movement and give you that support you are really hoping to be able to feel again.
So we would love it. I know these are personal issues that we're talking about, but if you have someone in your life that you know is dealing with these symptoms, please share this with them. Or if you are dealing with this and you're not comfortable posting a comment, please DM us. We are really passionate about this because, yes, for some folks, surgery and pessary, stage 3 and 4, we have worked with some women who are stage 3 or 4 prolapse, but their recovery looks a little bit different, and usually they're a better candidate for surgery and pessaries.
Especially stage 4.
Yes, most definitely.
Definitely stage 4. Stage 3, your results will be a little bit more limited than what we've gotten ourselves in this program, but definitely stage 1, stage 2, you got nothing to lose, guys. The amount you'll save in stress and missing out on events and spending on poise pads and doctor's visits and medicines and confidence. And we just want that for you too. So please reach out to us with questions of any kind. We're here and we want to lift the veil and explain and demystify for you, because Jen especially has walked that path and really knows personally how frustrating and overwhelming and confusing it can be. We're going to keep coming to you live every Wednesday at 1 p.m. Central Time with more information to empower you to move forward in your journey of recovery and not have to live with these symptoms forever, limiting your quality of life.
And if you wanted to get this delivered into your inbox and you're not on our email list yet, please go to tightenyourtinkler.com. We'll drop that link in the comments below. You can join our email list, and we're going to be sending this out to the list as well each week, if that's an easier place for you to find it and watch it.
Absolutely. Keep the questions coming, ladies. We're here for you.
Until next week.